140,000 children in South Africa were left behind without parents and caregivers, and this is due to the COVID-19 pandemic. This is according to a research that was conducted by the Imperial College London, which revealed that the country is also the most affected. Joining us now to make sense of these numbers is Toby. He's with UNICEF South Africa, a Chief Communications and Partnerships Officer there. Mr. Frika, thank you very much for your time. Just confirm those figures for us. Are these the children specifically who were orphaned as a result of losing parents to COVID-19?
Yeah, that's right. The figure, unfortunately, is massive, and it underscores really the broad-ranging impact that COVID has had on children, and households more broadly. So what we're seeing through that modelling, the data and the estimates shows it's now more closer to 147,000 children who've been left without a parent or a primary caregiver. And then that's a massive concern, because we know, from research, from history, that orphans are the most vulnerable children in society, and they really need the care, the nurturing care, the love as quickly as they can to have some stability. Like for any child, losing a parent, losing a primary caregiver is a massive traumatic experience, and that can play out in different ways over the years, from anxiety to depression and even anger issues as well. And that's why we're so concerned and need to provide the support. But also, just to say that there's also hope. These children can recover with the right nurturing care. Many are with extended family members who are loving them, who are caring for them, who are doing whatever they can to support them to access school, and other services. So there is hope there. It's just about providing that protection, as quickly as we can.
Toby, if you don't mind, just give us the quick insight into how this research was conducted, and importantly, who is taking care of these children? You've already alluded to some of them being taken in by family members.
Yeah, so I think over the years in South Africa, with the HIV/AIDS pandemic that's continuing now, what we've seen is extraordinary support from extended family members. And that can be uncles, it can be sisters, it can be other family members who step in when a child really needs that care. And that's also a massive strain as well. Let's not forget that working with, living with children who have been through such traumatic experiences in itself difficult. And requires specific skills. And that's why we're working with teachers, with early childhood development practitioners, with parents to try and provide sort of positive parenting techniques, to provide that little bit of extra support that can help them to cope with it, to manage and to love children in their care. But the figures are coming from modelling, from estimates that the Imperial College London have worked on, through the Global Reference Group on Children Affected by COVID-19. And they put together these estimates looking at COVID-19 associated deaths and also broader excess deaths that are related to COVID.
Toby Frika, let's leave the conversation there. Thank you very much for your time. He's with the organization UNICEF. Let's quickly take you back.